Good morning, everyone. We'll start today's briefing with Mayor John Cooper and Dr. Alex Jahangir, Chair of Metro's Coronavirus Task Force and Chair of the Metropolitan Board of Health. Alex will be followed by Erica Mitchell, Chief Community Impact Officer for the United Way of Greater Nashville, and Allison Holly, owner of Apple and Oak. Here this morning to help answer your questions will be Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Gil Wright, Interim Chief Medical Officer for the Metro Public Health Department, and Tina Lester, Interim Administrative Officer for the Metro Health Department. We'll now begin with Mayor John Cooper.
Good morning, Nashville. This is our 90th COVID press conference in what has been a long year for all of us. And there is good news in that a limited number of vaccinations are here, but meanwhile our COVID case numbers continue to worsen. By now you've heard that Tennessee is ranked number 2 in the nation for daily cases per 100,000 people over the past 7 days, and this is based on CDC data. And earlier this week, the COVID Tracking Project, which is used by Johns Hopkins, reported that Tennessee had the worst coronavirus caseload in the world. Now, this bad case trend was predictable. Tennessee is now just one of a dozen states without a mask mandate. Nashville has had a mask mandate. We have limited gathering sizes and capacity restrictions at businesses, but we are not an island. County lines don't insulate us. Most Tennessee counties have open community spread with no restrictions in place, and our state's COVID numbers reflect that. Nashville's mask mandate has contributed to our case count being less than half the rate in Tennessee's worst-performing counties, despite our higher density and higher risk profile. This is consistent with the Vanderbilt study from November, which reported that mask mandates reduced COVID deaths by more than half. Now, today in Nashville, our case count is 1,099. Over the past 2 days, we saw case counts of 857 and 1260. On Monday, Metro Public Health reported 1,311 new cases of coronavirus. That was our highest ever single-day report and more than 54% higher than our previous single-day high, which had been at 846 last week. Our 7-day percentage positive rate has increased to 15.8%, matching our record high for this metric and surpassing our positivity rate during the dangerous summer stage a few months ago. Now, 10% is our goal for this metric, and anything over 15% indicates that community spread is uncontained. Now, Nashville's hospital system serves as a safety net for 5 million people in a 65,000 square mile region, making our hospitals vulnerable here to regional health practices. And as of today, approximately 6 out of 10 COVID patients in Nashville are from outside Davidson County, and we currently have 500 active COVID hospitalizations in Nashville. For some time now, our local hospitals have been at maximum capacity, and we could reduce the overloading of our hospitals with a regional mask mandate. Now, our numbers indicate the post-Thanksgiving surge is a result of community spread, which happens in private settings and private gatherings, and not just in the regulated spaces of public facilities. The community spread we're seeing now isn't coming from our restaurants or other local businesses. Our latest public health enforcement report showed 100% compliance after more than 200 visits to local businesses. The disease is spreading when we relax our guard in private settings. We can't rely on regulations alone to keep us safe. We keep ourselves safe by our behavior. And our behavior can prevent a post-Christmas surge if we're responsible in how we manage gatherings during the holidays ahead. Now, the holidays are a wonderful time of year, but they can also add financial pressure to many households. And too many Nashville families are already facing hardships brought on by the pandemic. Help is available. You can visit covid19.nashville.gov or call 211 to connect with available resources like rent and utility assistance, healthcare and mental health services, and other essential needs, including food and housing. The Metro Council and the CARES Act Financial Oversight Committee has overseen the distribution of $91.3 million to date in federal CARES Act funds. 3 council members and 6 community and business leaders on the Oversight Committee reporting to the council created a business-like, accountable, and equitable allocation process. Now, part of our strategy has been to rely on trusted community partners, including the United Way and Second Harvest, to make sure this money reaches the families and businesses that need support in a fair and efficient way. Now, as of today, Metro's CARES allocations include $19 million to help connect over 80,000 MMPS students with distance learning, $10 million to help over 3,400 households with rent, mortgage, and utilities relief through the United Way, $4.2 million to Pathway Lending to provide grants to over 400 small businesses and live music venues, $2.5 million to provide food distribution and serve 189,000 people through Second Harvest Food Bank, and $4.1 million to other area nonprofits, including Conexión Americas and small business partners. Erica Mitchell, Chief Community Impact Officer at the United Way of Middle Tennessee, is here to discuss how the United Way has distributed over $8.7 million in relief money. Now, it's also my pleasure to introduce Allison Holly, owner of Apple and Oak, a Nashville home goods boutique. As a qualifying small business owner, Allison has received CARES Act funds through Pathway Lending, and she's put these funds to work in a unique way to keep her business running while ensuring her customers stay safe. Now, there's still help available for Nashville families and businesses. In the absence of additional federal support, we're hanging on day by day to determine whether or not Nashville and cities like ours will be receiving additional assistance from the federal government. Partly due to this uncertainty, we've had to carefully steward funds from our original CARES Act distribution, and that is to ensure a continuity of emergency response services throughout 2020 and into the new year. This stewardship makes sure that we will continue to have free testing centers and future vaccination sites available. Through the Metro Action Commission, CARES Act funds are also available to help Nashvillians at risk of eviction or foreclosure. Those eligible can qualify for up to 6 months of rental and mortgage assistance. And apply now through December 31st at nashville.gov/MAC. As a reminder, the SBA Economic Injury Disaster Loan Program provides low-interest loans to qualifying small businesses. Now, the deadline to apply is only 4 days away, on December the 21st. To learn more and apply online, visit sba.gov. And also, the Greater Nashville Regional Council has $2.4 million in CARES funds to distribute as loans to qualified small business owners. See if your business qualifies at gnrc.org. Now, in Nashville, vaccinations for Phase 1A1 are starting. Local facilities are beginning to receive approximately 16,000 doses of the Pfizer vaccine. But there are roughly 55,000 Nashvillians in this category, including 17,000 inpatient and high-risk healthcare workers, 30,000 residents and staff at long-term care facilities, and 8,000 first responders. The FDA Vaccine Advisory Committee, which includes Nashville's own Dr. James Hildreth, is meeting again today to consider emergency use of the Moderna vaccine. And Metro Public Health is expecting to receive its first shipment of the Moderna vaccine, roughly 3,000 doses, early next week, pending FDA approval. These limited doses will also go to A1A recipients, but the vaccine process will take time. After the initial shipment of Pfizer and Moderna vaccine, less than half of those in A1A will have received their first dose. Those receiving their first dose this week will not receive a second dose to reach full immunity until January. And experts believe it will be late spring or early summer before the vaccine will be widely distributed to the general public. As vaccinations begin, masks and other healthy habits remain our best defense against the virus. The COVID-19 vaccination program will be the largest immunization campaign in history, and we need your help. The Office of Emergency Management is looking for volunteers to assist at vaccination sites. We need non-medical professionals to assist with on-site logistics. And we also need medical professionals who are not already involved in COVID-19 efforts to help administer the vaccine. Training and PPE will be provided. And to sign up, please visit Hands On Nashville website at hon.org. Now, our community hero this week is Officer Arthur Calvin Brown, who manages security operations and maintains traffic flow at Metro's Community Assessment Center on Murfreesboro Pike. A proud member of the Aristocrat of Bands, he attended TSU and is a member of the Phi Mu Alpha Sinfonia fraternity. I'm grateful to Officer Brown for all he's doing to help Metro fulfill its public health mission in Southeast Nashville. And finally, remember the rule of 8 as you plan your holidays, which restricts gathering sizes across Davidson County to 8 or fewer people to slow the spread of COVID-19. By staying home and limiting your contacts, you can help protect yourself and your loved ones this holiday season. And now I'll turn it over to Dr. Alice Jahanger, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning. Here is the latest on coronavirus in Davidson County. Today, we have 6,062 active cases. That means nearly 1 out of every 10 Nashvilleian currently has this virus. That's also up 85% from last week. This is the highest number of active cases at any one time during this entire pandemic. The total number of cases is 58,939, with an increase of 1,099 cases just yesterday, making yesterday, again, the third day this week we have had over 1,000 new cases. The rolling 14-day average of cases is 563, and last week we were at 537. Our 7-day average per 100,000 residents is 91.4, up from 67 just last week. And our case positivity rate still remains above 15.8%. So far in Davidson County, 739,388 tests have been administered to our residents, and last week alone, 43,000 tests were administered. And 418 Nashvilleians have died, 25 just since we last spoke. The transmission rate in our city is 1.31. Again, one of the highest it has ever been in this pandemic. And hospitalizations are also really critical currently. We have 857 individuals hospitalized in our regional hospitals, an increase of 20% from just this time last week. And 500 people are hospitalized just in Nashville hospitals. Again, 23% increase from this time last week. Now this week, Tennessee has been identified as one of the worst places in our country, in fact, our world, for this pandemic and new cases. Nashville is 48th out of 95 counties. We are seeing this post-Thanksgiving surge we all warned you about. Our contact tracing is confirming of this. In fact, 33% of cases that have occurred in the 2 weeks since Thanksgiving have been traced to a household contact. And this confirms what we worry about. During the holiday, people spent a lot of time indoors in houses with family members and did not take the precautions needed. And these new cases are having a significant impact on our hospital systems. I've spent every day speaking to the leaders of our hospital systems. And what I can tell you, our largest regional hospitals are now turning down medical transfers every day from other hospitals. And these are often smaller hospitals in rural communities. All 3 of our large hospital systems report they're at max capacity. All of them report that staffing is tough, especially in the ICU. You must realize how serious our hospital situation is. It's really bad. and I believe it has the potential to get worse if we continue doing what we're doing. Our hospitals are seeing the stress that we and our neighbors and the communities around us are having by putting our guard down. With the hospitals ahead of us, with the holidays ahead of us, we must do what we can to prevent a post-Christmas and post-New Year's surge. We can't continue to have cases continue like this, and you have to remember, it is not inevitable that there will be a surge. Nothing's already written out in stone. It purely has to do with how you and the rest of our community acts over the next several weeks. So remember, if you're going outside of your bubble, wear a mask, even indoors. Stay in, keep your distance. Maybe open some doors for ventilation. It is cold and people are more likely to be indoors. And be very careful around your older relatives. And a reminder, if you've been exposed or you're having symptoms or you're concerned about this virus, get tested. Our community assessment centers, which have now provided over 280,000 free tests to our community, are open every day, usually from 8 a.m. to 3 p.m. But check every day, as weather does affect those hours. And as a reminder, next week during Christmas, Christmas Eve, Thursday and Friday, the 24th and 25th, our assessment sites will be closed. Nashville, we have to focus. We have to remain vigilant. The upcoming holidays can really be a really bad time for us, and so I ask that you please do your part. Stay apart, wear a mask, and keep your distance. Thank you.
We'll now hear from Erica Mitchell of United Way of Greater Nashville. Erica?
I'm going to share a little bit of information that Mayor Cooper spoke about regarding Metro Cares. Shared just a moment ago, more than 3,400 households, representing about 7,000 people, have been kept from eviction and foreclosure thanks to the support of Metro Cares for rent, mortgage, and utility assistance. These are singles, these are moms, dads, children, grandparents across multiple zip codes in our community, all who have been kept safe and housed over the last several months and into the holiday season. United Way is extremely grateful to Mayor John Cooper's office, along with the Metro Cares subcommittee, and the service providers within the financial assistance network who have made this possible for so many folks, just in keeping them safe and housed during the holidays. So we have a lot of gratitude and a little bit of good news as we head into the holiday season.
Thank you. Now we'll hear from Allison Holly of Apple and Oak. Allison?
Hi, thank you for having me. Thank you, Mayor Cooper and team. My name is Allison Holly. I own Apple and Oak in East Nashville. We are a rug, gift, and home accessories shop. We were a recipient of the Nashville CARES Act grant, and we have taken this money and we're using it to pivot to local delivery. So in order to keep people safe and keep them home, for people who've been exposed or are just taking this seriously, we are offering local delivery for anyone in the Nashville area. We have the zip codes where we're delivering listed on our Instagram page at Apple and Oak Nash. And you can order on our website and we'll deliver it to you within 24 hours. I want to thank the Nashville community for being so supportive of small businesses. Every single purchase makes a difference, and you've really come together this holiday season, and we appreciate it very much. So continue to support your small businesses. Keep your money in the community and stay home.
Thank you, Allison. There are no media questions today, so I'd like to thank Erica Mitchell and Allison Holly for joining us. And as always, we're grateful to Amy Lankite and our partners at Bridges for the Deaf and Hard of Hearing for providing the ASL translation at these briefings. The next COVID press briefing will air on Thursday, December 31st at 9:30 a.m. Thank you, and this concludes today's briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.